So yeah, we're sort of hoping to help with quality of life for longer. We sometimes focus on the physical symptoms, sometimes on the psychological stuff, but also some of the stuff that comes around cancer, because everyone says, cancer is very expensive, and transport costs, parking costs, various other things come into it that people don't even think about or contemplate. And for many people, it sort of becomes a full-time job, if you like. But and sometimes we talk about those topics, that we think are important, planning ahead for when you're maybe less well one day, whenever that might be. It might be 3 years in the future, it might be 10 years in the future, but when you're less well, less able to communicate, what are your wishes? Some people may say to me, Mark, whatever happens, I want my dog next to me. I don't want to go to any setting where the dog isn't allowed, and the hospice allows dogs, for instance, that kind of thing. Others might say, it's really important to me that I never have a feeding tube inserted into my stomach. I wouldn't want to be sort of unconscious somewhere and someone decides they're going to start putting a feeding tube in or something like that, and that's a complete horror for me, and I wouldn't want that. So you can actually make your wishes quite clear with future care planning resources that we've got in Wales. It's on the www.wales.nhs.uk/AFCP website. And there you've got different resources like advanced decisions to refuse treatment, so an ADRT, which is filled in by a patient, signed by the patient, and witnessed by someone independent. And there you can specify the things that you would refuse in future were you to lose capacity or were you able to not communicate something. You can do something less legally binding than that. You can do a sort of more general advanced care plan or future care plan. Sometimes best to do that with your key worker, your clinical nurse specialist, your oncologist, or your palliative care doctor, to sort of say, look, what are the things that I might be facing in the future? What do they involve? What are the pros? What are the cons? Would I want that? I don't know. Or no, I wouldn't want that. Or yes, I would want that. And then you can specify that with some forms that you can then log via the GP and via the specialists as well, and they can put it onto their electronic systems. So it's all there for you. So that's just really briefly, over sort of 7 minutes, I've sort of explained some of the issues that can be quite important. Of course, I could talk for much, much longer, but maybe you've found that a little bit helpful. Thank you.